I'm Rachel Bade, Politico's Capitol Bureau Chief, and I'm joined today by Florida Congressman Vern Buchanan. Thank you so much, Congressman, for being here. The Congressman currently serves on the House Ways and Means Committee. He has for a while now. How many years did you tell me just back in the green room?
Too many, but 14 years
14.
On that committee, but it's my 10th term.
Currently, he oversees the Health Subcommittee, so obviously a big player in the area we're going to talk about today. And he also co-founded the Make America Healthy Again caucus in the House. So we're going to talk about that too. And by the way, back in the green room just now, he was ribbing us for the unhealthy, sugary snacks that were in the green room. So already starting his advocacy here. But before we get to healthcare, let's start with a little bit of news from last night. You're obviously a Florida Republican. Last night, Republicans in your state did win, as sort of was expected, 2 special elections to replace Matt Gaetz and Mike Waltz, but they were closer margins than I think a lot of Republicans would like to see. What's your sort of takeaway from last night?
The one in Jacksonville, we felt pretty good initially on that because it had a lot to overcome. It's an R+20 or something. But the one in Melbourne, some of the polling had it at one point, could have gone either way. We brought in a lot more resources, whatever that was. But originally, he had raised about $1 million, and the candidate, the race got nationalized, so it ended up with another $10 million on his side. So we thought it'd be a tougher race than it was.
Well, it's interesting. One of those races was like 30. President Trump won it by like 30 points,
yeah.
And now it's much, 10 points a piece on each of those districts.
Yeah.
Are there any things that Republicans need to sort of internalize, any lessons, you think? Or do you think this was a purely like, the money piece that was talking here?
It makes a big difference. It's a part of the Orlando TV market. So when you're talking about 1 million and 10 million, it grabs your attention. So there was a bunch of different things. I wasn't as active in that race, maybe wrote a check, but short of that, that was focused on what's going on here in Washington for the most part. But that was a big issue. It was a very big concern to a lot of us. I chair the delegation in Florida. And so all of us were a little bit nervous about it at one point, but then the numbers started moving in our direction. It's all about turnout in these little, these smaller races in terms of that.
And I'm sure Speaker Johnson is happy today with that margin and not losing those seats. So let's talk about MAHA. Why did you decide to create the House MAHA caucus? Tell us about your decision to do that, and what do you want to do with it?
Well, their focus is on diet and exercise and some other things. And my experience we all have our own life experience. I was in business for 30 years and other things, but you deal with your weight over the years. And one diet that came up changed my life for the last 20 years. I lost 30 pounds, kept it off, and don't have to think about it as much. Someone had wrote a book, and there was an equation in the book. And on the top of the equation was nutritional value of the food. And on the bottom of the equation was calories. So what is the most nutritional food with the fewest calories? And you can eat all you want. Now, obviously, it's a lot as it relates to vegetables and stuff like that and fruit. But that changed my life. And then my grandkids, we have 10 grandkids, 10 and under, they'll say, Papa, you can't eat that or you can't eat this. But I told them I got a 20% where I'm more open-minded in what I'm eating, or not as careful on that, but I try to be more scientific. And that's made a big difference to me just on weight management and everything else. And I could take that off the plate. And you can eat all you want. You just got to eat the right things.
So I could have a donut for lunch, but then I got to skip
But that's on the
dinner
20%, yeah.
But really, what is Congress's role here? I mean, we talk about nutrition. These are very personalized choices. What do you envision your caucus actually doing?
Well, think about it this way. We're spending $4.4 trillion on health care. Right now. And Medicare just alone, I think it's $1 trillion, 1 or 2, and it's getting worse. So we're spending more money, and the results from what we're spending is getting less. So we have to play a role in this space, because if you take a look at Social Security and Medicare, it makes up a third of the budget. When you're taking in last year, we took in, and this is the bigger picture that as a business guy I try to look at. When you take in $5 trillion in terms of receipts and you spend $7 trillion, that's got to end. When I came to Congress, don't blame me, but it was $8 trillion. Today it's $37 trillion.
What'd you do?
But my point is we've got to change that. My first week in Congress, I introduced the balanced budget amendment in every new Congress since. But we need to get serious about and deal with that, because at some point it's not a matter if, it's when it becomes even a much bigger problem.
So it's interesting because back in the day when I first started reporting back in Obama's first term, Republicans sort of, went bonkers on the Obama administration, on Democrats for trying to promote at times healthy choices. I remember some Republicans saying Democrats were trying to demonize sugary snacks at the time when grocery prices were high. I remember Republicans sort of mocking Michelle Obama's Let's Move campaign about combating childhood obesity, and just Republicans sort of attacking, mayors, governors, Democratic governors who wanted to sort of limit access to sugary soft drinks. Were Republicans wrong back then? Or can you just talk to me about what is the genesis of, the Republican Party now being the one carrying the Maha sort of mantle? Like, I think what happened in 10 years?
I've been focused for the last couple of years on this Maha before it became Maha, in a sense, because if you look at their 4 principles. But I think the big part of it is it's new leadership, and people are looking at things differently. I'm clearly looking at things differently, because we can't continue down that road. You mentioned the obesity factor. Well, children, 20% obese today. Used to be 3 or 4 or 5%. If you take a look at adults, 40, 45% obesity. This leads, as you know, to type 2 diabetics. In terms of the military, we can't get a lot of the kids, 31% don't qualify because of obesity. So there's a lot of things we've got to change and look in a different direction. And I think that change comes. And we all hear about over the years diet and exercise, but diet is the key in terms of what you're putting in your system. You need good fuel. That makes a big difference. And then you need to move. Someone said, go for a walk 2 miles 5 days a week, and I'll take you off a lot of that medication you're on. So there's a lot more we can do in that space, and we got to encourage and educate. And not everybody's going to do it, but we'd like to see more people step up and make a difference. I know businesses are doing more in that lane. They're building fitness centers. I didn't see as much of that before, but I'm associated with businesses, and a lot of them are going that way. But we have to all work together. My big picture is you've got to be the CEO of your own health. You can't just count on outside services. The way we react, in terms of the way we pay people, too, the whole idea of paying doctors and everybody else, fee for service, that's got to be looked at. It's the wrong incentive.
Do you think, is it a matter of Congress sort of writing legislation to incentivize this behavior via some sort of tax incentives, or funding for schools if they promote X, Y, and Z healthy things? Like, how do you envision writing policy to actually prescribe and to encourage people in a certain direction?
You make a good point. It's all about the incentives. And as a business person, one of the most powerful tools I had working with all my managers and different people was getting the incentive right. And I think you got to question the incentive in terms of fee for service. I think it creates the wrong incentive. And so I think we have to take a look at other opportunities in terms of setting up a structure and everything. But that's something I want to work on, and we're going to work together. I had a chance to meet with the Secretary Palm Beach maybe a month or 2 ago, and then this past week, and we had a good discussion, and we're both moving down, I think, parallel together, working together in a lot of this. There's a lot more we're going to do. He's going to get out more. I've asked him to come to Florida, and he's accepted to do that. So we're trying to work through some of those details. But the idea is, we've got to find a way to bring down the cost, and a lot of the cost is tied to chronic diseases. I think 80, 90%. I just personally believe we could eliminate a lot of chronic diseases through a better diet and movement. I think it would make a big difference.
So we have to talk about Medicaid right now, because obviously Republicans are in this sort of position on Capitol Hill trying to move President Trump's legislative agenda. Big question right now is what happens with Medicaid. We've heard Democrats suggest that Republicans are going to cut the program in reconciliation. I know Republicans have said they are not going to do this, but your colleagues in the instructions for reconciliation did prescribe $880 billion worth of cuts that perhaps might come from this program, Medicaid. What cuts do you think Republicans will make there?
They're looking at it, but I can just tell you, I'm not for cuts in Medicaid. It's people at most risk, children and families, and single moms and stuff like that. So, I'm going to do everything to make sure it doesn't go down the road. But I can tell you, being here, there's a lot of inefficiencies. We've got to find a way to be able to trim a lot of the costs down, do things better for less. And I think in a lot of it, we got to get the diet right with a lot of these, especially on the Medicaid, with especially kids, as I mentioned, 20% obesity. So there's a lot of work to be done. And I think the president's made it pretty clear in terms of Medicare and Medicaid, and that does impact my district. I have the 5th oldest district in the country, but it impacts a lot of districts. We want to keep that viable.
What about work requirements on Medicaid? Is that something you would support?
Ideally, where you can, but if you're talking about single moms with 3 kids, I don't know how that works. But the bottom line is that's something some people feel strong about. I think you got to look at based on the situation.
What about reimbursement rates for Obamacare Medicaid expansion? Do you think that is something Republicans will touch?
I think it's something they're going to look at. That's just my feeling, that we haven't got there on that discussion, but I think that's something they're going to clearly look at.
And you support that, then, finding savings from the Medicaid expansion?
Yeah,
Okay.
Medicaid, Medicare, Social Security, I'm for all of that, because what we're doing now isn't working. You can't continue to spend trillion. Our interest on the debt's $1 trillion a year. So you've got to take the first trillion of taxpayer money and pay the interest on the debt. It's got to change, and we've got to find a way to do that where we're more efficient on delivering these systems. I can just tell you, there's always been a feeling like on Medicare, for example, that there's at least 10% fraud or mismanagement or whatever. That's been clear. Everybody kind of agrees on that. And those types of things have got to get addressed. And we haven't done it. And, you're talking, hundreds of billions of dollars.
Easier said than done.
Yeah, it's not easy.
Yeah. So speaking of, we were just talking about the Obamacare Medicaid expansion. One of the sort of most underreported healthcare stories this year is actually the expiring Obamacare cost-sharing subsidies that end later this year. For people who are not familiar, those subsidies are for oftentimes middle-income earners who the original Obamacare law did not necessarily help or address. They're often self-employed, small business owners who make a decent income, but when it comes to buying your whole family's health insurance, that's much more difficult. We are now seeing a broad swath of the industry, like hospitals, insurers, run ad campaigns asking Congress to extend those subsidies. Do you think that Congress should do that?
We're going to be looking at everything. We're in this process right now in terms of taxes, but also in health care. And we're just looking at the whole package. There's going to be some things that'll be, trimmed, however you want to look at that, especially where there's waste and inefficiency. And then there'll be some things that might be added to in terms of programs. So I can't tell you because nobody knows yet. These are things we're working on. I'm going to go to a meeting now for 7 hours. We're going to talk about like taxes, which is it is a reality we got to deal with because of 2017. So all that's expiring this year. So we're going to spend a lot of time about what's going to get in the basket and what's going to have to come out.
I was going to say, I don't think I've heard people talk about the subsidies, the Obamacare subsidies, in terms of this reconciliation package, right? You guys aren't talking about doing it now. It would have to be a later.
Yeah, that's my sense of it, too.
And is there a belief that there's fraud there that you guys think you can go after?
I just think we need to find a way to look at any way we can do things better for less. And I can just tell you, I've had a lot of friends that tell me every 4 or 5 years they would just purposely, even if it wasn't a problem, blow up an organization so they can go and redial it in. Because there's just a lot of stuff that creeps in where people are not as productive as they were originally, and we just got to find a way to be more efficient and do with less for more.
Last question on the the Obamacare subsidies. That would likely have to be something you work with Democrats on, right? Or do you see Republicans being able to do that themselves?
I think most people know me. I'm probably one of the most bipartisan members up here, and that's my record. And so when I work with my colleagues that are Democrats, I try to find a way to get to yes. That's my mindset. They bring me something. They know to bring it to me as a senior member on Ways and Means. I try to figure out how to get the yes where it makes sense. Some people don't like that, but that's the mindset I bring to it. I want to fix things as a business guy, And one way to fix them, the majority of the time, is working with your Democratic colleagues. And they've got good ideas too, but we need to figure out a way, especially in terms of this debt and deficit, that we work together. So that's kind of where I'm at.
You mentioned a 7-hour tax meeting today. Man, that sounds brutal. But I have to ask you, there's another one, I believe, Thursday, where you guys are going to hash out between House and Senate what you guys are going to do on the tax piece of reconciliation. Since I have you here and you're on Ways and Means, what are the sort of must-do things in your mind? You know, permanency, no tax on tips, no tax on overtime. What sort of dials are you guys looking at turning in order to make sure you can get?
We want to try to keep permanent what we did in 2017, a lot of it. But, you know, corporate tax will go to hold at 21%. Pass-through entities, there's a thing called 199A, it's a 20% reduction. It gets more parity with corporations. Full expensing is a powerful tool, whether you're buying or selling. Interest deductibility is something that we're discussing now, but we'd like to resolve. So there's a lot of things going to be done. And what we're doing is taking a look at, you know, we've got to get to a number and what we can keep like in the basket, keep it in, and what's got to go outside of that. But I can just tell you that we're trying to get as close as we can to 2017 and bring some permanency, because it's not fair to companies where they're trying to manage their cash flow and their tax liability and stuff like that, and it keeps changing every year. Like the depreciation now, it goes down 20% a year in terms of what they can depreciate. That's just crazy. But I just feel very confident about where we're at in the process, and we'll deliver on that.
So just to recap there, permanency obviously is the goal for the previously passed Trump-era tax cuts. And then in terms of these new ones, it sounds like that maybe that's not going to be permanent.
Well, I've got the bill on tax on tips, so I like it. We're just trying to price it.
How long do you think you can do it for, realistically?
Yeah, I don't know. Maybe 5 years or something. We'll see, but it's something the president wants. They asked me to pick it up and carry it, so we'll see if we get the support and get the votes and get in the caucus as well.
Well, there is a red blinking light here, which means I'm out of time, but I have to ask you. So you're going to the White House today to the Rose Garden for Liberation Day, as Donald Trump calls it, a big day on tariffs and trade. You previously chaired the trade subcommittee. I mean, are you at all nervous about what we're going to see today and how the markets will react?
Yeah, I'm not exactly sure where the president's going to go with this, but I do think we need to build and make friends around the world. I've been to 85 countries, and we're getting ready on a trip coming up to Europe. So we need to build. When I go to these countries, my mindset is we've got a good relationship with a lot of them, but how do we make it better? And I know the president's got what he's doing, and I respect that, but I try to bring a little bit different element or vision to what we want to try to do with our neighbors. I think, especially as you look at the European countries, that's just a natural to do more in terms of trade and opportunity. That's what we're going to be working on.
Does it concern you, though, that he's considering, the reporting says universal tariffs or tariffs for every country? Like that's the opposite of what you're talking about here.
I'm telling you what I want to do.
Right.
Okay, I would like to do. That's the way I approach things. Mm-hmm. I tell people, we have 350 million people in the U.S., but 7 billion on the planet. We've got to find a way to work together and get along. The president's got his agenda in terms of, trying to make things in his mind fairer. But I take a little different approach from my standpoint. I'm not saying, but I'm interested like everybody else. I've got some sense of what he's going to talk about, but until he talks about it, I won't know.
I don't even think Susie Wiles knows at this point what he's going to do. So
if someone does know, it's her.
Yeah, if someone does know, it's her. Congressman, thank you so much for your time.
Thank you.
I really appreciate it.